Hey everybody, this is Professor Beth RN from nursing.com, and today I'm here to help you break down, understand, and strategize answering next-gen questions. While nursing school gives you a solid knowledge base, clinical judgment makes you the safe new RN when you're caring for patients. I'm here to help put your mind at ease with these unfamiliar question types so you can pass that NCLEX and ultimately start your dream career. Let's get started. Okay, guys, so how do I know that this is a drop-down style question? So a drop-down question will give you client information with options that you can select from drop-down menus. So they're going to look like this guy here. Basically fill in the blanks, but with options. So I know if I clicked on this, if there were a blank here, these are my options. I have 1, 2, 3 different options for this particular drop-down blank. This type of question can be presented in 3 ways. We have drop-down close. This type of question will give you a paragraph of information all the way up to 5 sentences. And each sentence will have one of these. They will have a drop-down, okay? And then when you click on it, each drop-down can have up to 5 options. So if this guy has 3 options, I could have up to 5. A drop-down table, this option can be as wide as 5 columns, and it can be as long as 3 different rows. Now, these guys are a little tricky because on these rows, you can have more than one correct answer. So we'll work through one of these guys together since it's a little harder. Drop-down rationale, this is just one sentence. I like that. But in that sentence, there are 2 to 3 drop-downs, right? So you're completing a sentence. Think. An example, dogs love blank because it makes them feel blank. So maybe I would choose dogs love treats because it makes them feel happy, okay? These types of questions can hit any of the clinical judgment model. So because of that, our best strategy is going to be to take our time to read, whether it's an EHR, a scenario, or those table column headers, right? Because all tables can be different. Let's go ahead and let's do one together. Okay, so here we are at nursing.com, and I see that this would be a drop-down table. So I have 1, 2, 3 columns and 1, 2, 3 rows. And clearly, I'm going to have 2 correct answers on each one of these rows. So I don't see an EHR. I don't see a scenario. So let's get started. We're going to look at column headers, medication, drug classifications, and patient teaching. So obviously, what's the drug? The drug is what classified as what drug family, and what do I need to tell my patient about? All right, furosemide, first drop down. Is it a loop diuretic? Is it potassium sparing? Is it a thiazide? Okay, so this is a great question since up to 19% of your next gen is pharmacology. And that's okay because nursing.com has an awesome NCLEX pharm prep course. So if you need to brush up, come visit us. All right, furosemide, this is a loop diuretic. Okay, I know that because I was decent at pharm. Patient teaching. So do I take this medication at bedtime? I'm not going to take a diuretic at bedtime. I do not want to pee the bed. I'm going to skip that one. Encourage patient to not restrict oral fluids. So people that need to take diuretics need to get fluid off. So they probably do need to restrict their fluid. I don't like that one either. Instruct patient regarding potassium sources in the diet. Probably going to do that because a loop diuretic is what? It's potassium wasting, right? We're going to get rid of potassium. So we probably need to eat some, like spinach. Propranolol. Is it a calcium channel blocker? Is it an ACE inhibitor? Is it a beta blocker? So I remember from pharm that anything ending with LOL is a beta blocker. But what do I need to teach my patient? I could report symptoms of shortness of breath. This drug may mask symptoms of low blood sugar, or I can take an extra dose the next day if I missed one. Okay, so we know I would never pick this. I'm not a provider. I can't tell patients to take extra doses. That is out of my scope of practice. I also know that beta blockers mask signs of hypoglycemia, right? Beta blockers block catecholamines. So catecholamines are when your sugar's low, you're going to sweat, get nervous, tremor. So this is high sugar. So I don't like this because beta blockers mask symptoms of hypo or low sugar. Okay. So I'm going to pick this guy by default. Amoxicillin, is it a penicillin, a macrolide, or a quinolone? Geez, I can already tell amoxicillin, penicillin, they have the same exact ending, a suffix. I'm picking it. Should I discontinue the medication when my symptoms have resolved? If I did that, we know to never do that, right? My doctor would yell at me. Monitor for signs of an Achilles tendon rupture. That happens usually with quinolones like Levaquin. Would I complete the full course of therapy? Well, I would. We know our doctors want us to finish our antibiotics. We'll submit that. Boom, 6 out of 6 points. Awesome. If you've missed one, of course, you would get partial. And you could tell that nursing.com will always have rationales for you because you need to know your rationales. Always make yourself notes, little bullet points. Why is the correct answer right? Why is the wrong question wrong? It will help you as you continue to take more practice questions. Okay, drop-down questions, how are they scored? So drop-down, close, and tables, we just finished a table. That's considered the 0 out of 1 scoring rule. So that means you get a point for every correct response. Drop-down rationales, those have the rationale scoring. And what that means is that you have to have your pairs of answers fit together. So dogs love treats because treats make them happy. If you didn't get treats and you didn't get happy, you don't get a point. But the good thing is that you'll never have a negative score, right? There is no negative scores on NCLEX, which is a positive in my book. So again, just to summarize, what are we talking about? Drop down, right? Drop down, no matter what kind this is, it's drop down menus to fill in a blank, right? That's what it's doing. We're filling in blanks. What helps? Know that drop down tables can be harder due to all the columns available. I want you to really read into those column headers thoroughly before you proceed. And then get to know your clinical judgment model, because there may be some words in there that are hidden, right, in the columns. So if you see something like maybe complications, or you might see something like analyze, right? So it just depends on what verbiage they're using. Perhaps you'll see the word outcome, but really, what are they having you do? Evaluate. So get to know clinical judgment model verbiage. Great job, guys. You guys got this. Apply your nursing knowledge to these question item types. Use the tips and tricks we discussed, and I'll help you answer your NCLEX questions accurately. Before you know it, you'll be celebrating passing all your tests, including your NCLEX. I can't wait to celebrate with you guys. If you want to learn more, come see us at nursing.com. We have more questions and practice for you. All right. And as always, happy nursing.